All right, we will get started as folks keep pouring in. Thank you all for joining us today. For those of you that are joining us for the first time, I'm just going to give a very brief introduction to what this community of practice is and what we're hoping to accomplish together in these bi-weekly conversations we've been having over the last few months. For those of you that I haven't met yet, my name is Carlos Diaz. I'm director at Hathaway Communications, and along with my colleagues at Hathaway, we serve as the secretariat for the STAT communications community. This community grew out of the State and Territory Alliance for Testing. It's a group of states and territories convened by the Rockefeller Foundation who share insights, best practices, successful strategies, and lessons learned on all aspects of the COVID response. The goal for expanding this community and the motivation for these bi-weekly meetings, as they have been for now almost a year now, is to bring the same spirit of collaboration that has made STAT such a success to the broader community working on COVID communications. A second motivation is to bring that same rigor and science that inform other aspects of the response to strategic communications. That's why we're particularly excited about today's conversation on lessons learned about setting up successful testing programs in universities and colleges and building communication strategy to talk with students, parents, and faculty. We know this is a very timely topic given the month that we're in and back to school. So today we will be hearing from David Clark, CEO of SHIELD T3, Dr. Craig Stephens, San Filippo Professor, Biology Department and Public Health Program, Santa Clara University, and Celine Schmidek, Associate Vice President of University Marketing and Communications at Santa Clara University. Thank you to our panelists for spending time sharing these valuable lessons today. We know these are very, very busy times, so we very much appreciate you spending the time with our community today. Today, they'll be speaking on how to build successful testing programs with students and faculty in mind, and with a quick turnaround, how to meet students where they are with communication methods and messages, and building partnerships across campus and with vendors to solve problems rapidly and strategically. As we go, as always, we encourage you to leave your thoughts, experiences, or questions. You can either share questions in the Q&A box or in the chat box, whichever you prefer. Just one thing, if you're sharing comments in the chat, please make sure to share with panelists and attendees so that everyone here in this webinar today can learn from each other. We will be gathering questions as we go, and we'll share them once the panelists share all the insights that they have for us today. With that said, I'm going to turn it over to David Clark to get us kicked off. David?
Yeah, great, Carlos. Thank you. And thank you for the introduction. Good afternoon, everyone. Again, my name is Dave Clark. I have really the pleasure of working with a really talented group of folks and innovative folks at SHIELD T3. I help lead that organization. And the first thing I want to do is just thank STAT and Hathaway and the Rockefeller Foundation for putting on this webinar series and for their sponsorship and for really their belief in SHIELD T3 over time. I think it's really kind of telling that we were invited to join this webinar on universities and a look back and a look forward on where universities are in terms of dealing with the pandemic, because SHIELD T3 was born out of the higher ed education system. We were born out of the University of Illinois. You can see the University of Illinois moniker here at the top right-hand corner of this slide. When the chancellor of the University of Illinois was sending 40,000 students home last March, he turned to his development labs and said, figure out a way to get our students and our faculty and our staff back on campus safely. They did that. They fully reopened the campus in July, last July. They were fully open all of last year, in-person classes, and they were so successful in July, August, and September of putting a program in place that involved very extensive testing. And there were so many inbounds from other universities on what were they doing and how are they being so successful, because by the data, they had one of the safest college campuses in the country. And so they decided to put SHIELD T3 in place as a wholly owned subsidiary of the University of Illinois to take their testing methodology and their technology out as far and as wide into the communities as they possibly could. And we started out with, we were talking about how we were saving lives day in and day out. Now we talk about reopening and keeping students in class and keeping communities safer with our testing programs. We serve more than, I think it's about 80 now, college campuses across the United States. We also serve K through 12 systems across the United States, private employers across the United States, literally from Maine to California. And through this experience that we have, and it's led by our experience on college campuses because they're typically very large testing programs, that we've developed a fairly unique vantage point on what works. And what works when we say the goal is mitigating transmission of the virus. That's the goal. And what works is not a secret. It's well publicized, it's well out there. It is a layered approach. It's a layered approach with vaccines right at the core, with personal hygiene and social distancing and masking and air filtration. But one of the things that we think really is multiplicative in terms of its effectiveness of that entire stack is putting a effective testing program in place. Now, I also have to say, and I'm going to set up Celine here for her discussion later, you also need to have a very robust communication program for any of this to work on your college campus. You have to get people to buy in with that communication program. But that combination of that stack, from vaccinations all the way through air filtration and a testing program, COVID testing program, it's the combination of all of those that works. And it's not the same combination on every college campus. And some college campuses may have the ability to emphasize one or two of those planks and de-emphasize one or two of the other planks. But if you're not going to have masking, boy, you better have really good air filtration systems and really good testing systems. If you're not going to have a testing program, boy, you really better have great vaccinations, really good hygiene and social distancing programs, and communications on how to effectively put those in place across the campus. But along the way, not only is that stack important, and it's not just the stack, and it's not just the concept. We have real data. We've studied this. We've studied it on the University of Illinois campus. We've studied other campuses. We have the data. We have the modeling, and I'm going to show you some of that and connect you with some of that work here. But first, let's talk about testing, because if we go to the next slide here, we'll see testing programs are not difficult. There are a lot of details involved here, but there's a couple of things they need to have. One, a testing program needs to be extremely accurate as you could get. It should involve gold standard in terms of accuracy, and it's because through that accuracy, you detect source of infection sooner within individuals. And that's really, really important here. There are tests out there that our research labs know don't work. They're basically window dressing. They might make people feel better, but they're not impactful. And they're certainly not impactful in terms of trying to keep a university setting safe. You need to have very, very high accuracy. You also need to have very high speed of response, and speed of response measured in hours, not in days. And if you look back on where we were a year ago, there were testing programs in place, and some of them, we didn't get results for literally the fastest was 48 hours, 72 hours, sometimes longer. And the testing programs, the effective testing programs today have literally 4, 5, 6 hour response times. And that has to do with mitigating the transmission of that virus, not allowing that virus to infect others. If you find a positive individual in your community, you want to remove them from the ability to infect other people in your community as quickly as you possibly can. And the speed has everything to do with it. So together with accuracy and speed, you also need to be affordable. And cost cannot be the governing factor not to do testing. on a college campus. It should be just the opposite. In fact, if you have high accuracy, you have very good speed, you should be optimizing the cost, because if you have those three things, your overall cost of your campus in mitigating the impact of the virus on your campus is going to go down, and it's going to go down over time. And so if you have a good testing program in concert with the rest of the planks that we talked about, your mitigation is going to become cheaper over time, not more expensive. So let's talk about the difference a year makes. If we can go to the next slide. A difference a year makes. You know, you look at this and you say, man, things haven't changed that much. We're still dealing with a pandemic, and it's gone from being a deadly pandemic to being one of the leading causes of death in the United States. It was very, very easily spread, but now it's more infectious than ever in terms of the Delta variant. There was a fast changing environment, a lot of different decisions made, a lot of new information. I got to tell you, I don't think that's slowed down over the past year. There's a lot of uncertainty, and there's a lot of uncertainty literally today on college campuses about how they're going to handle fall mitigation programs. However, there's some good news here. Last year, testing programs were very unproven at this point in time. This year, there are very, very proven testing programs, and those mitigation strategies that I talked about, they're all very proven. There's no secret to them. We move from testing symptomatic folks, only those that feel sick, to testing to stay programs where you can even be exposed today, but stay in in-person classes. You don't need to, if you have a good enough testing program in place, you don't need to remove and basically quarantine people just because they were exposed. You only quarantine them when they become infected. And man, there were a lot of people searching for the right levers to pull to how to control transmissibility. And today we have blueprints for transmissibility control. And here I just want to share this with you. At the bottom of this page, there's a new paper that was just published out of the University of Illinois labs, just published last week, as a matter of fact, on August 5th. It's in the Med Archives. The link to it is here. We'll get this information out to you. There truly is a blueprint here out of how to keep your students on college campuses in class and how to run your campus more safely, 10 times safer than the community around your college campus, with no barriers, with well put in place, well communicated programs. And so I got to tell you, some people are saying, well, woe is us. And we're still in a very tenuous position. And by the way, I just talked to a couple of our researchers at the University of Illinois yesterday. We're still not out of the woods here in terms of the impact of this virus, impact of the virus on college campuses, impact of the virus on our communities. We have a long way to go yet. And so testing, I believe, and these mitigation strategies are going to be here for a long time yet. One thing we know, if we just switch to the next slide, one thing we know is those testing programs, we've proven it through data here on the right-hand side of the slide, but putting effective testing programs in place, and you can literally reduce the positivity rates and the number of infections on your college campus. You can see here a university that started out just below 1% in terms of a positivity rate. And towards the end of the semester, this is before they put in wide-scale vaccination programs, they were down to 0.1% positivity rates. Same thing in high school, started out about 0.5% in terms of their positivity rate, down to 1%, and kept it down at 1%, or I'm not 1%, 0.1% or lower over time. These testing programs work, and we have the data to prove it. And so here we are, this is where we are in the US on the left-hand side of this slide. I noted where we were on August 9th last year as I was putting this slide together yesterday. You can see the new cases in the 7-day average. And here we are this year on August 9th. And so where are we going to be headed when colleges come back to class? Well, we better be communicating our mitigation strategies really, really effectively on our college campuses. And I really hope that, that our colleges are using these well-known mitigation strategies, putting them in place in the right combination to serve their university, their college, emphasizing the ones that make sense for their environment and for their student body and faculty. But we know that folks that have testing programs in place on their college campuses are going to be able to stay open this year. We know, because it's been proven, that they're going to be able to keep students in class, and they're going to be able to keep their populations safer. So please let us know if there's anything we can do to help. And I really think at this point in time, it would be great to hear the Santa Clara story.
All right, we can go on to the next slide. Thank you, David. That was a fantastic introduction. And thank you also for the partnership that we've had with Shield T3 over the last year. So I just wanted to start out with a quick introduction to Santa Clara University. We've been around for a long time, 170 years now. We're located in just outside San Jose, California, in the heart of Silicon Valley. One of our taglines is the Jesuit University in Silicon Valley. We're a small to mid-size campus, just under 9,000 total students, undergrad and grad. We're very proud of what we do here, ranked in the top 15% of universities nationwide. We're not a research university, though. We have a lot of research that goes on, but we don't have a medical school. We don't have a hospital. We don't have very large labs. So as you'll see, that has implications for how you actually carry out a testing program. So if we can go on to the next slide, please. So I just want to give you an idea of what we've done and then some of the lessons we've learned, and then we'll talk about where we're heading this fall. When we started testing last summer, so the summer of 2020, it was actually quite difficult to set up an on-campus testing program. Pretty much all the testing being done in our county was being done through the county health department. I should say that we're located in Santa Clara County in the Bay Area in Northern California. And we were, the Bay Area was one of the first areas of the US that was hit by SARS-CoV-2. So we had a lot of infections going on in our community around us. So as we tried to set up a testing program in summer of 2020, we initially partnered with a laboratory in LA called Fulgent. And Fulgent does a great job. They have a very high capacity testing program, but we were having to send tests down to them. Fortunately, we had very few residential students. We basically went completely online. So we were testing essentially the sort of the residual on campus faculty and staff and students in the surrounding community. So we did around 5,000 tests. If I remember right, we probably had about 150 to 200 positives in that fall term. As we went into winter, we welcomed a few more students back on campus, but that was also when the December and January surge started to hit. So fortunately, that was when Shield T3 became operational in our county. They set up a satellite lab in Sunnyvale, California, and we started working with them because we could get results a lot faster if we were just basically driving them 20 minutes or so to the lab. So the way we went at that point was to have mandatory weekly testing for anyone who was located on campus, and then voluntary testing for all the students who were still living around campus. And our university absorbed the cost for all of this. Our primary partner was Shield T3. doing saliva-based testing, but we also did some nasal testing through 2 other laboratories, Telomere and Color Health. The saliva testing is significantly cheaper than any testing based on nasal swabs. That has to do with the methodology of the testing, and it tends to be faster also, which was an advantage of going with Shield T3. Saliva testing is also fairly non-invasive. So that was our choice. It reduced by about half the costs of testing for us. And we ran our testing program through volunteer staff because our operations had largely gone online. We had a fair number of university staff that we could retask to support the testing centers. We also hired a student workforce to actually work in the testing center, which is basically distributing the materials and then collecting the samples afterwards. We have a very strong pre-med and public health program at Santa Clara, and most of our student workers came from that pre-health program. So we did walk-in, no appointment testing. We did about 27,000 samples over a period of about 6 months. Had about 400 positive samples, and we peaked at just over 2,000 tests per week. And then we gradually tailed off as we exempted people from testing as they became fully vaccinated. Should point out this was before the rise of the Delta variant, when vaccination was made people pretty safe from getting subsequent infections. If we could go on to the next slide, just want to hit a few key lessons here. As David said, fast and accurate results are really critical. That allowed us to get the information to the contact tracing unit we set up on campus so that they could try and prevent the spread as much as possible. We worked with our local health department as much as we could. To be honest, they were fairly overwhelmed, so they give us some good advice, but we were not able to rely on them to actually execute anything. We had to basically figure most of it out ourselves. Building partnerships, building the partnership with Shield T3 was incredibly important. We actually helped them improve their performance while they were helping us improve our performance as well. But building partnerships all across campus was really critical. There are IT issues, facilities, logistics, all kinds of stuff. And Celine is going to talk more about communication, but a lot of the communication she was focused on was outgoing communication with our students, parents, community, et cetera. But communicating on campus is incredibly important as well. Things get done a lot better if people understand what you're doing, why you're doing it, and what you need to be successful, and if they buy into that mission. So that's really important. Adaptation was incredibly important. Testing is constantly changing. Everything in this epidemic is constantly changing. We have to be aware of what's going on in the epidemiology, what's going on in our local community. There are so many different things that we need to be aware of and adapt to. And testing is certainly one thing that we were continuously adapting to over the last year, figuring out the best strategies. And then finally, just it's really important to be patient. There is a lot of fear in the on-campus community and the off-campus community, among parents, just among the population in general, about what's going on in this epidemic. And so accomplishing what you need to accomplish means trying to be calm and patient and moving forward despite everything that's going on around you. Then last slide for me is, if we can go to the next slide, looking toward fall of this coming year, which as I was telling the other people on this call, we are just setting up our first testing event today for the law school, which starts classes next week. We're on quarters, so our main undergraduate population doesn't start until September, but it is not far away. We have mandated vaccination with very few exceptions, and that is the most important tool you have right now. Unfortunately, in the COVID world, the Delta variant is making us rethink whether vaccination even is going to be enough. The Delta variant can infect people who are vaccinated, and it can even be transmitted by people who are vaccinated. Fortunately, people aren't going to get very sick. Most people are not going to get very sick. So vaccination is still hugely important, but we don't think that we can only rely on vaccination at this point, because there are risks still of transmission on campus. Campus communities really are prime breeding grounds for this sort of epidemic, because we have dense housing, we have young people who are socializing a lot, we have people in classrooms, as you do at any school, so you're bringing a lot of people together. There are a lot of measures that we take, like we're now back to requiring indoor masking that we had done away with at the start of June. So there are public health measures we can take, but we still think that testing is going to have a really important role. So at the moment, what we are focusing on is entry testing. When you first bring a bunch of people back together, we need to make sure that we have a handle on if there are infections in that population. And the end of summer, the travel, the socializing is sort of, college campuses regularly are places where respiratory virus can spread easily. But the things that are going on right at the start of the quarter can really ignite a lot of infections. So testing can identify those cases and hopefully constrain spread on and off campus. We don't know yet how much ongoing testing we're going to need this fall. It's really going to depend on local conditions. The Delta variant is being projected to slow down in September and October. We certainly hope that happens. If it does, then we may be able to not do as much ongoing testing. But for any unvaccinated people and contacts of known cases, we think we're going to need to keep testing those at least through the fall quarter. But we also want to make testing available for anyone who needs it, especially heading into the cold and flu season, when symptoms can pick up and we need to be able to differentiate between COVID and something else. Okay, so those are my thoughts heading into fall quarter, and then I will turn it over to Celine, who has been enormously important in communicating what we're doing to all of our constituencies.
Thank you so much, Craig. I just want to say hello to everybody and thank everyone for joining us for this webinar. I lead as Craig said, I lead the communications and marketing team here at Santa Clara. So we are tasked with really leading the charge and making sure information goes out in a timely fashion to all our stakeholders, all our audiences. And like many of your institutions, we convened some key kind of COVID-19 response teams. And there's a leadership team that we support from a communications perspective. So I'll go through some of both the planning and the lessons learned that we've really taken away from the past year. And this summer was also an opportunity to reflect on what's gone well, what are some of the opportunities and some of the ongoing challenges. And like many of you, we made a lot of difficult decisions in how we go about communicating pivots, changes in plans. At the same time, for many of you who are public information officers or who may be in communications teams or crisis communication response teams for universities and other not-for-profit institutions, we had to wrestle with so many other controversial issues, racial reckoning, a lot of other things blew up last year. So needless to say, I feel for you all. There's never a dull moment in the communications front, but we should all take a lot of pride in what we've learned, what we've done. And here's some of the nuggets that I'd love to share. And I'm curious to hear if you have questions or comments that you've encountered in your own institutions. First, it's really important to meet audiences and stakeholders where they're at and to communicate where they like to best glean information. And we're finding students in particular like information on demand. So as much as most higher ed institutions are still email centric, blast out decisions on email, we want to make sure we support that on both our social media and in our university, we have a mobile app that students like to check and find out information. We really can never forget parents and families. They're such a critical piece, whether we, parents are just so much more hyper involved these days in terms of what's happening with their students, and especially in the middle of a global pandemic. So they're a critical audience for us. We communicate with them constantly, make sure what we're communicating to the campus community is also being communicated to parents and families. And we also never want to forget our extended alumni, and in particular, our neighboring community, because that's key, especially when we did vaccine clinics. You know, we did old school flyers throughout, you know, neighboring grocery stores. We did a lot of social media. We teamed with our local city government to get notification out on vaccine clinics being held in the university. And then I think that other second key principle that worked for us is really using transparency and constant repetitive communications as one of our key strategies, because there's just so much noise these days. It's important to repeat information to make sure it's getting out there. It's key to maintain a robust website of information. And at Santa Clara, we call that Prepared SAU, kind of an overall umbrella. And our FAQ, particularly our vaccine FAQ, is just constantly being refreshed in light of the vaccine mandate that Craig described. And in light of the fact that, you know, when you send an email out, it may not get read, but at some later point, someone needs to know what buildings and facilities are open, where can they get XYZ question answered. So we do, my team, so in awe of my team, because we've been answering so many questions, thousands and thousands of questions to a central email box. So where you can do kind of one funneling of information, that's key. Last year alone, we did 57 weekly emails where we did kind of a digest in bullets, the key things to know, especially for our undergraduate students, a roundup of every, you know, news, COVID-related news item on campus. And we sent 57 weekly emails alone. And then finally, this is was really exciting for us. We did 26 weekly episodes of an Instagram video series. We have a very telegenic public health lead, Professor Kat Saxton, one of Craig's counterparts, who is popular with students. And we, our team partnered with her to create, you know, short videos heavy on Bitmojis and fun graphics, as you can see, answering the most basic questions. And this was getting upwards of, you know, 60% completion rate, you know, 3,000 to 5,000 views a week. Students submitted questions every week, and that's what she answered in her Instagram series. And it looks like one of my colleagues dropped in the link if you're curious on the format of that. And then a more important thing that I think many of us learned in the higher ed space is to think about the burnout on your communications team. The communications cadence was so hard on my team because we were doing these roundup emails every Friday afternoon. And you got to think about, you know, the downstream effect of how late your social media manager is working, how late your web person is working, all your comms people to get all those announcements out on different channels. So we moved that up to much earlier. You know, deadline was Thursday at 4 so that we could get it out Friday at 9 so that nobody was having to work, you know, 8 o'clock at night on a Friday. It's just, if we can go to the next slide, please, my last slide. I think there's just, you know, this is repeating much of what Craig has said, but from a communications perspective, it's just so important to really think through cross-departmental collaboration. For many of us, some of you may work in smaller institutions like Santa Clara, we don't have a lot of redundancy. We don't have a lot of people. And the same people were getting really, again, burnt out. And so we're thinking through what's worked, and it's been, everybody's been chipping in, all hands on deck. Where it made sense, we thought about backup teams or rotation, so that if folks, especially in the key roles, you know, folks can rotate out if needed, if that's possible at all in any of your institutions. The second that I can't emphasize enough is it's hypercritical to have communications at the table when key decisions are being made, because communications can help think through the pros and cons, the exposure to potential backlash or questions, any reputational risk. Certain decisions from a public health perspective are probably completely necessary, but how you communicate it, how you explain a decision is key. And crisis communication experts can really think through a layered response formulate recommendations for communication next steps, how to say it, or perhaps even a more robust campaign or program. So it's not just, communications, it's not just quick emails or signs. We can really make sure that it fits into the overall brand identity and mission of your institution. The third thing that I know many of you do, as we do as well, is we closely monitor and benchmark other similar size institutions. Clearly Stanford, San Jose State are kind of our peer institutions right here in the Bay Area. But we factor in different circumstances, different situations. I constantly talk to my counterparts at the Associated Jesuit Schools, Jesuit colleges and universities, the AJCU, institutions like Gonzaga, Loyola Marymount, University of San Francisco. So it really helps to kind of be in a bigger community, just like what you're doing here as part of the Rockefeller Foundation. Next point is it's so important that we ensure that there's actually, as Craig said, every local county, local public health authorities might have shifting guidance, but we actually have a couple people here at Santa Clara from our risk compliance and general counsel that are the point people to make sure we're getting time with our local health authorities. We can ask questions. We join the universities that are part of Santa Clara County. Make sure that we're staying on top of the changing guidelines. And second to last final point, where we can engage, we engage in proactive scenario planning. We just are in a couple meetings that are happening today. Actually, we are having some honest conversations on coverage, response, what are the real challenges we need to anticipate, what are the real opportunities to reaffirm the commitment of our campus to safety, to our core mission. Those are the key things. And the graphic on the right, for example, shows that, right when our county the Bay Area counties announced this new indoor mask requirement, this was a social media post that went out immediately. So I just want to leave with this final thought of, we all need to be prepared for surprises. We all need to, accept that there's going to be ongoing uncertainty in this pandemic. Just as David said, I love the positive. What we know this year is better than where we were last year, right, David? So welcoming the progress we've made and while staying flexible and nimble. And then for all of you in the front lines, make sure, especially those leaders, all of us leaders, we need to model self-care because we all need to stay strong and hopeful in the coming months as we deal with our institution's opening. So with that, I'll turn it over back to Carlos and Caroline to moderate the chat and questions. Thank you.
All right, thank you all so much for such a wonderful and illuminating presentation. I'm sure folks have lots of questions and comments to share. We did have a few that were pouring in while you were all sharing your slides. I think, David, one of the first questions we got from Rashida Lalmalani. She asked, what about molecular tests with a high accuracy? Could they be used in place of PCR?
Yeah, I think there's been a lot of studies out there, including work done directly by the CDC on antigen tests in particular. I think there's a spot for them. We don't think, Carlos, they're very effective in a screening application. The sensitivity of them is just too low. The accuracy of them is just too low. They do give you a very fast response, but the accuracy just isn't where it needs to be to screen. Okay, if you need to know if someone is infected and infectious right here, right now, that's a good application for them. Okay, but not if they might have been exposed, right?
Thank you, David. Craig, we also got another question from Rashida while you were sharing some of your information. They asked, are we concerned about the Lambda variant?
Yeah, I mean, I think we should be concerned about it for the future. For now, it hasn't really penetrated much into the US. There's some indication that it may be more contagious like Delta. There's possible that it could evade some immunity like Delta. But it's not a major issue for us right now. That said, we need to be aware that things can continue to change in the next few months in the next year. It's very possible that Lambda will come here. The more vaccination we have, the better off we'll be. And it's also possible there will be other variants after Lambda, but I don't think right now it's a major issue.
And Celine, I think when you were sharing your final thoughts, there was a comment that I think probably resonated with lots of folks around the comment of burnout. We heard a comment from Lori Andrews here on the burnout is real. And they said, here we go again with the surge. Almost had a break, but no, PTSD has been mentioned by at least 2 colleagues in public health comms. I'm wondering if you could share more examples on how you help with burnout in your team.
Yeah, it's very real. A couple people in my team have had to take a medical leave. And I think you, as leaders, I would really make sure that you're doing, weekly, very frequent check-ins with especially the folks in your front lines. Just like any marketing communications team, we have kind of specialists by function. So unfortunately, it's a little harder, to do rotations, but really be intentional about check-ins, really put people first. I mean, at the end of the day, we're all gonna get through this together, but we always have to put people first. And it's been a particularly painful time for communications, just, constant questions, the amount of emails and social media comments is just 24/7. So I really urge leaders to, first of all, practice self-care, model self-care. So if they see that you yourself are, taking PTO as needed, then they'll feel like they can actually unplug their phones and really make sure you're checking in with your folks, because you want to catch folks. This keeps me up at night, Carlos, to tell you the truth.
Yeah, and I think one of the great also strategies that you mentioned was, this cross-departmental collaboration, which can really help spread the effort. I remember one of our earlier talks, Craig even mentioned of helping with Instagram stories. I'm wondering if you both have more examples of how you facilitated that cross-departmental collaboration.
Yeah, so my team in particular, since many higher ed institutions are, I would say, hybrid decentralized. So even though I run the centralized marketing communications team, there's actually marketers out there in campus. So my team provides Canva templates, Canva being a very easy to use graphics platform. So you don't want someone going rogue and announcing, oh, you don't need to wear masks in the arts and sciences building. They still have to follow really what's supposed to be kind of the university main line in terms of the rules. But where we actually did a fun campaign of #StaySafeBroncos, we employed all the marketers across campus and all the student groups on campus. Post videos on how you stay safe, post videos, because often, in the local news here in the Valley, we were getting coverage for the large parties that did happen off campus. There wasn't as much coverage on the students who were abiding by the rules, who were being faithful to staying within their pods and bubbles. So we basically counteracted that with a campaign that we then created, templates so it can go viral within our little community.
Yeah, it sounds like you foster really great collaboration with the community. And we have another question from Shannon Mora on the Q&A chat. They say, I love the recommendation to have comms folk at the table. To what extent have you included students with communications?
Yeah, for sure. Kudos to Craig and Professor Katz-Saxton. The peer health educators have been such a huge help. And one of the things when Craig and team switched us over to the saliva testing with Shield T3, one of the couple of the lab workers, Craig, I can't remember their name, they created a video that then UMC was able to take their video and drop in graphics. It's all, students want to hear from students. So we absolutely use students And I now have a full team of student interns back on my University Marketing team. So we'll be using students even more.
That's awesome. Another question I think I was thinking through while you were all explaining, David, given this relationship with universities and colleges probably gets started very quickly, meaning once you start, you're probably put to work immediately. What should both organizations such as SHIELD T3 and universities make sure to do in order to maintain good productive relationships while you deal with testing that is so critical to keeping these institutions open?
Yeah, I think my knee jerk to that, Carlos, is high communication rate, right? There's a lot of details that go into setting up a testing program, everything from rostering or what type of reporting that you're going to put in place, reporting to students, reporting to the university, what those report templates look like, reporting to departments of health. And so there's just a lot of details to work through, and you need to be successful in a very short amount of time frame. You actually need to spend more time communicating, not less time, in order to get stood up very, very quickly. And then obviously ongoing communication, just staying in touch every month with what's going on college campuses is extremely important to us and our success.
Thank you. Sorry, Craig, were you wanted to add anything to David's?
Well, I was going to say, for example, I have the cell phone number of the lab manager at SHIELD T3, so I can ask them if there's any issue, or I can always know when I can drop samples off, things like that. But also, SHIELD T3, for example, has made some nice videos explaining the testing process and collateral that we can use, signage that we can use at the testing centers, explaining how things work, et cetera. And obviously, customer support for somebody who's being tested, so they know who they can email if there's a problem or whatever. So yeah, communication is really the name of the game, a lot of the name of the game, at least for this.
Absolutely. We have another question in the Q&A chat from Nina. And this one says, do you have any tips for coordinating the many marketing and communications departments that exist at a university system? How did you ensure everyone was on the same page in messaging, even as things are changing so quickly? I think that's an interesting one, given the university can have dozen different Twitter channels and many newsletters and emails and web pages out. How do you manage that coordination among all the different channels?
Yeah, that's most definitely a challenge. When we announced the vaccine mandates, as much as we had a robust vaccine FAQ that addressed, once that came out from our leadership, there was just still an evolving list of questions. Specifically, we had a couple of grad programs that start on a semester basis, our School of Theology, our School of Law. And so it was really important to kind of all get on the same page. So we're fortunate that, this is just kudos to my team. I call my team the team of yes. We always want to be so approachable that no question is ever trivial. Like, we want to be able to help formulate the answers. And so we've kind of trained campus marketers and assistant deans in all the various schools. And again, it's always a challenge in the university because it tends to be very decentralized. We do a tracking doc for responses. And in very many cases, when someone disagrees with a decision, they'll email everybody, from like freaking all the trustees that they know, from the president, acting president, all the way down. And so you need a tracking doc then to like, how many people got an email from this person, because we need to then, all be on the same page in the response. Because often they're contesting, they're not agreeing with a particular decision. So it's key that, we've kind of trained all the various folks to just, and all our leadership, our cabinet has always said, when it's communications, please go to Celine and team, please go to our university marketing communications. So, and really now that we've announced our vaccine mandate about, is it 3 weeks, Craig? I think our FAQ, our questions are finally starting to slow down because we have enough, all of the frequently asked questions on the website.
Yeah. I'm wondering, both for Craig and Celine, what are the most common types of questions you got from parents? Were there any common themes you were seeing over and over being repeated as you got as the situation progressed?
There's so many. You go first, Craig.
Yeah.
Well, I don't get all of them first. I don't have to screen them like Celine does. There's a lot of questions about vaccinations. There are, for example, we have a decent sized international student population, and those students don't all have access to the same vaccines we do, and some of them don't have any access to vaccines, depending on what country they're from and how old they are. So, what were we going to accept with that vaccination mandate? For example, we're going to be doing entry testing. So I imagine there will be a lot of questions about, can I get tested at home before I come to campus? Is that okay? So I mostly see the questions about testing and vaccination, of which there are quite a few. There are also, masking now. We've gone back to indoor masking on campus, even though people are vaccinated. So I imagine there will be a lot of questions about that. Celine?
Yeah, a lot of questions right now on mostly technical questions. So then it helps guide us to were we not clear in the last, communications and how they upload their proof of vaccination. A lot of questions on vaccinations in process. And then right now it's just kind of, we were all optimistic that things could be closer to normal. So for example, our study abroad program just issued their announcements in terms of programs, because there's a few, they're smaller, much smaller than normal, but because usually we send upwards of 500 kids to various programs, primarily in Europe, but there's a ton of questions about that, ton of questions about move-in. So, because we're back to what I would consider normal density in our housing, in our dorms. So basically 2 to a room, typically. So a lot of questions on keeping, move-in safe, welcome weekend activities. And then after that, we usually have a robust, set of grand reunion activities. And those are the things that I think with the changing public health guidance, the teams that Craig and I sit on, it's being decided on right now. You can't pre-announce too much right now because things change, right?
Mm-hmm.
So, and some of these are very large events. Our grand reunion gets upwards of, 8,000 to 10,000 people on campus.
Wow. Thank you. We have another comment in the Q&A chat. This person says, this is also helpful. Could someone share actual links where we can find SCU's most effective visuals messaging materials, asking for inspiration purposes? I'm wondering if there's anything anywhere in your site where they could access for that.
Yeah, I have a few folks who are in my team, Elliot and others, if you can drop in the Prepared SCU, kind of our main portal. And then I would urge you to follow us on social media, Instagram, Facebook, LinkedIn. And because that's really heavily how our students like to digest information, and how we send out, much of our interesting videos as move-in approaches. But yeah, I'd love to hear from other universities as well. I'll friend me on LinkedIn, and I think we're all in this together, everyone. There's just so much to learn from each other.
Absolutely, and we will share those links in the recap email after this session. One other question I think would be interesting to hear from you all is, has there anything that has surprised you in how students adapted to testing routines? Because I remember in the earlier pandemic, a lot of articles about how students weren't really following protocols in universities. I'm wondering, for all of your case, and also David, with the different universities that you work, did you find that to be the case, or did you find other things that surprised you in how students adapted and received the messages that you were sharing with them?
Yeah, I can tell you from my perspective, and I've been on college campuses all across the US, the communication teams that really stand up and hit the ball out of the park, that's where students are paying attention. There are no surprises. Mm-hmm. I've seen many very, very impactful communication just very, very well coordinated communication messages that are repeated over and over again in multiple modes, multiple ways, multiple locations across campus, and to the point where you literally can't get away from reminders about what are the right things to do. Stay masked, keep social distancing, whatever they might be for that particular campus, just very creative ways. And so I again, Carlos, see just the communication and marketing teams just do an amazing job here. And where they've done those really, really solid jobs of communicating, there haven't been any issues at all.
I'll just throw one thing in there really quick. One thing that did surprise me and kind of disappoint me a little was we had a period in the winter when most of the cases that we did have were linked to off-campus parties, right? So these are students not living in dorms, and we honestly, we don't have much control over them. And the testing was voluntary. So students that were getting infected started avoiding testing on campus. They started going to like free testing sites in the county because they didn't want to get in trouble for getting infected. So there's kind of two things you have to do there. You have to make sure that students know that testing is not connected to any kind of punitive measures. You know, our contact tracing is not going to the Office of Student Life and saying, you know, these students should be whatever, suspended or something. So that was one thing. But the other thing I think was that you have to involve students then in the communication in the student community to help get the message across that, you know, these kinds of events are putting everyone at risk. And it's affecting what you might be able to do in the future. It's affecting the health immediately of your campus. And just hearing those things from, you know, from the faculty or from the administration or whatever, I think is not always as effective as hearing it from their students. So incorporating students into those communication strategies, I think, is really important.
Yeah, and I think to echo that, we did, as Craig said earlier, we did welcome reduced density population in our on-campus housing in the spring. And it was really tough to just, you know, some of we have these residential learning communities. Some of them were really creative in going outside and doing smaller groups. I think mental health is a serious issue for our students and our youth right now. So I really want to encourage those of us in universities to never forget to put students' mental health first. And I know we're always championing for our colleagues in student life to put on events creatively, you know, take them outside, still be masked, but still make sure people are making connections. Because unfortunately, the same freshmen and sophomores who lost out in the end part of their high school careers, you know, they're the ones kind of struggling right now as, you know, how do they find themselves, make friends, still abiding by the rules, as Craig, you know, I think the off-campus partiers were more upperclassmen. But now it's like our lower classmen coming into campus, we really have to think through. So it's not a surprise so much, Carlos, it's just really struck us that, you know, it's very real. Mental health, you know, how do you maintain your core mission of being a welcoming campus, you know, educating these young people and still abide by, you know, safety rules are key. So we need to somehow balance all of that.
Absolutely. We are almost at time, so if folks have any last minute questions, please drop them in the chat. But I do want to take the time to thank all of our three panelists for being here and sharing, I think, such important lessons, successes, but also the challenges that you face. I think some of the things that you've shared, I think, have really resonated with folks. I think especially the point about burnout with communication teams, I think is one that is probably resonating with folks, and it's important to acknowledge. So thank you all again for being here and taking the time. Thank you all of our attendees. We'll be sending a recap email with the slides and additional materials, and hope to see you again in the next 2 weeks for our next webinar. Thank you all.
Thank you.
Thank you.